Hello there, and welcome to another episode of Sociology is Good for Your Health. As always, I'm Mariam, and I'm joined by my co-host Natasha. How are we today, Natasha?
I'm great today, thanks, Mariam. I'm just looking forward to discussing today's topic.
First up, today we have Jared and Mersel. Thank you for joining us today. Would you be able to give us an idea of the organisations we have available to all of us today?
Not a problem. I'm glad to be heard today. Suicide is so predominant in all of our lives today. Why and how does this keep happening? What can we do about it? Who is out there for us? We all know we have family and friends, but what if we don't want to burden them or we don't know how to discuss it with them? If that's the case, we have many organisations to help us. Lifeline, for example, is easy to get in touch with. They can be contacted on their crisis hotline at 13 11 14. Let me repeat that one more time. 13 11 14. For issues such as suicidal thoughts, attempts, personal crisis, anxiety, depression, loneliness, trauma, or stress. They also have a website if we don't feel comfortable talking. It may not even be if the person wants to commit suicide, but rather just want the pain to stop, even if it's for a few moments. By providing this service, such as a crisis hotline, it allows those suffering to be heard, to feel safe, which alleviates the thought of suicide. This belief is also shared by Beyond Blue, whose research suggests that people who think about or attempt suicide often just want their psychological pain and distress to stop. The Beyond Blue app helps people who are feeling suicidal make personalised safety plans in order to help support them. This safety planning helps them reduce the risk of suicide by allowing them to identify and seek strategies for their needs, situation and personal relationships.
These organisations are luckily available to everyone, but sometimes we need to start at the root of the problem. This usually occurs during our youth. Fortunately, we have Headspace, which focuses on early intervention for those aged 12 to 25 years old. It provides a holistic mental health support for them. It's important to target this specific age range in particular, as this is the age where we all transition from child to adult, bringing us a variety of challenges that can arise during this crucial time in their lives. Headspace centres are available, reflecting the need of the community, and provides young people with the support for mental health, physical health, alcohol and drugs, work and study support. Headspace also has a national telehealth service for those who live in rural and regional areas. This allows them to have video consultations for psychiatrists in order to assist them with their struggles. And like Lifeline and Beyond Blue, they also have online and phone services to provide young people with the opportunity to talk to a professional and discuss their worries in a safe, secure and anonymous manner. To target youth directly, Headspace also has specific mental health education tools and access to mental health specialists for young people in primary and secondary schools across Australia.
Resources that are available to our Indigenous communities are the Aboriginal and Torres Strait Islander Suicide Prevention Advisory Group. This group promotes mental health and well-being as well as awareness for suicide prevention for all Indigenous people, whilst addressing the impact and prevalence of suicide. The group also encourages improvement around suicide prevention for all Indigenous communities and addressing social and emotional health and well-being. According to Professor Pat Durgan, who specialises in Indigenous health at the University of Western Australia, has found that suicide was the leading cause of death for Indigenous youth aged 5 to 17. In a 2019 article titled, "Why Are We Losing So Many Indigenous Children to Suicide?" She continued to outline, although the Indigenous community only accounted for 2.8% of the population, 1 in 4 children had committed suicide, were of Indigenous background. The Australian Bureau of Statistics published a report in 2019 that shockingly reported that 167 Indigenous Australians died from suicide. Male Indigenous Australians accounted for 39.6 deaths per 100,000 persons, whereas female Indigenous Australians had a rate of 11.9 deaths per 100,000 persons. Suicide, unbelievably, is the 5th leading cause of death for Indigenous Australians, which is absolutely unacceptable. Despite suicide prevention programs, those that are Indigenous are 5 times more likely to commit suicide, and as the country that prides ourselves in our multicultural identity, the problem of suicide needs to be addressed.
What amazing organisations! It's great to see those on the front line are hearing us and allowing our cries for help to be heard. It's awesome to hear that there are also so many organisations trying to help, even before it may become a problem. But I can't help wondering, if these organisations are on the front line, then what about those in the background, those who research this?
Hi girls, thanks for having me on the show. So the Black Dog Institution is an organisation that identifies, prevents and treats mental illness with the promotion of well-being. Using these discoveries that are made in the area of mental health, it immediately puts us into practice by administering them through health services, technology, and on teaching people to recognise the signs of poor mental health in themselves and by others by providing them with the right psychological tools to control mental well-being. The Black Dog Institute combines clinical management expertise with innovative research to develop new and more effective strategies to support people living with mental illness, and has research dedicated to covering early intervention through to management, including suicide prevention, workplace mental health, and prevention in young people. Black Dog Institute also has clinics that provide a great service to help manage mental health conditions with GPs, psychiatrists, and psychologists. This provides these clinics with resources such as information about mental illness and online self-testing, and also provides professionals with information toolkits as well as information regarding clinical services. So basically, to put this into short words, we place focus in those with specific mental needs, like young people, Indigenous communities, and men and high-risk workforces. You can visit and access all this information at www.blackdog.org.au.
What great organisations! With all these suicide statistics, it seems that our government is unwilling to do anything about this. This can't be right.
Actually, it isn't. Our state government has a Victorian Suicide Prevention Framework in place, which is a 10-year framework created in 2016 going all the way till 2026 in an effort to improve the mental health system here in our home state. The framework's goal is to halve Victoria's suicide rate by 2025 by implementing 5 objectives. Objective 1 is to build resilience. Objective 2 is to support vulnerable people. Objective 3, care for the suicidal person. Objective 4, learn what works best. And Objective 5, help local communities prevent suicide. In addition to this, Victoria recently has had a Mental Health Royal Commission, which aims to provide evidence and advice on ways to continuously improve Victoria's mental health and suicide prevention system, and act as a catalyst for change to achieve those improvements. With the assistance of health.gov, a government health website that organises regular events to raise suicide awareness, offer easier access to health professionals, and including information regarding the National Suicide Prevention Strategy and other helpful information. To assist our current serving and ex-serving men and women, we have a Department of Veteran Affairs, which is a government department in charge of all things associated with our current serving and ex-serving men and women. This includes mental health care and offers help in suicide prevention from a variety of reasons, from mental health to physical health for both them and their families. They also work in conjunction with Open Arms, another organisation that provides mental health and wellbeing support for current and ex-serving Australian Defence Force personnel and their families. Open Arms, while not government-related, has similar values and resources offered by the government, such as a 24-hour helpline service, and provides counselling and group and individual workshops, group treatment programs, suicide interventions, and provides a support network for at-risk individuals.
It's absolutely wonderful to see everyone getting together in an attempt to solve this problem. Question though, are they working? Do these interventions actually address how society may cause this issue?
The current interventions do address social patterning issues through the use of statistics, graphs, and comparing data. Life in Mind shows that from 2014 to 2018, the number of suicides for people aged 15 to 19 years old is increasing. For people aged 20 to 24 years old, the average mortality rate is somewhat the same. It is increasing for those 25 to 29 years old and decreasing for the people aged 30 to 34, 35 to 39, and 40 to 45 years old. Statistics from 2018 by Life in Mind show that the age standardised suicide rates for those living in Greater Melbourne is lower than those living in the rest of Victoria. This might be linked to the access to healthcare interventions linked with mental health. Although current interventions address that social patterning, they do not address the causes of these statistics. Although we do know that depression can lead people to suicide, we are not provided with the cause of that depression. Because as the professionals at Life in Mind say, as I quote, "There is no single reason why a person attempts or dies by suicide. The causes are all unique for each individual dealing with different things."
Thank you for sharing these statistics with us. It is a complete eye-opener that people aged between 15 and 19 and 25 to 29 years old are experiencing an increase in the prevalence of suicide. When considering these numbers, it makes you wonder if it's due to the fact that these groups heavily rely on and consume so much social media, or even the possibility of them struggling with the constant pressures of life. I think it's fair to say that we all know how tough growing into ourselves can be in this stage, among things like peer pressure and being told that we need to settle down and become adults. But let's be real, do we ever really feel like adults? Well, I mean, I know I at least haven't gotten to that part yet. And honestly, all these things can just become so overwhelming, and it just happens at the drop of a hat. Well, enough about that. As we can tell, these statistics do show an alarming increase in the rate of suicide. So I pose this question to you. Do you think in the foreseeable future there will be more interventions put in place to control the rates of suicide?
Unfortunately, no, Natasha. Suicide is something that statistically will unfortunately continue. It has been stated by Lifeline that the deaths by suicide in Australia for men is 3 times that of females. It is also stated that over the past decade there has been an increase in female suicide deaths. It is scary to think that 65,300 people attempt suicide each year. Although these are alarming statistics, through the use of advertising different suicide interventions, we can still help make a difference in these people's lives. Further action needs to be taken for suicide prevention, as rates from 10 years ago are still on the rise. As more people of all ages and different demographic backgrounds take their own life for many various reasons, a further reinforced mental system needs to be redesigned for more adequate care for patients. Hopefully this could allow for more checkups, reassuring patients and referring to more specialists. So basically, suicide intervention can help make a difference for people. Sometimes even simple communication like a text, a phone call, or a meet up with family or friends can make a difference to someone. This can let someone know that they're not alone. If you ever notice signs or symptoms, or even such social withdrawal, mood changes, excessive use of drugs or alcohol, try to be that person that makes the contact and be there for them. And always tell them that you are not alone.
I absolutely agree with you on that. I found it interesting that men in Australia have 3 times more suicide deaths than females. I think it is in our best interest to always check in with our loved ones. By checking in with your loved one and reassuring them that it will be okay, it might just save their life. Natasha, what do you think about this?
Completely agree with you both. I think that it is important for people to talk to their family and friends. I think that people in society still think that if you are suffering from mental health illness or hardship in your life, that they should keep it to themselves and not discuss it with anybody. This, however, should not be the case. It is important to reach out to our loved ones in our time of need. Even if you are in a dark place, give a friend or a loved one a call. It's not weak to speak about your emotions. Like you said, it could in fact save your life. Talking about things could stop the ripple effect that committing suicide would have on your family and friends. And if you think your friends or family need someone, reach out to them. Even if they aren't in a bad place, I'm sure they'd love to have a chat with you, and who knows, maybe it might make their day. So, I'd like to thank our 3 guest speakers for taking the time out of their busy schedules to join us today. It has been a privilege having you on Sociology is Good for Your Health. I hope the information that has been given today helps our listeners better understand suicide and what interventions can be put into place to help people who are affected by this. And just remember, it's never weak to speak about your feelings.
Was a pleasure, Natasha.
No problem. Thanks for having us.
Thanks for tuning in with us, and I hope you can all benefit from the information we discussed today. A big thank you to our special guests and our wonderful listeners. We hope you can all join us next time when we talk about more health in sociology. Please remember to look for signs of mental illness in the people around you and even for yourself. Don't be afraid to speak out and get help. If you enjoyed today's Sociology is Good for Your Health episode, then don't forget to like this podcast. If you're new to the channel and you want to hear more Sociology is Good for Your Health content, please subscribe. Stay safe and we'll catch you next week.